face before perhaps, but my name's Andy Haken. And on July the 1st, I came in and assumed the role of President and Vice Chancellor of St. FX University. I'm currently in Antigonish. I'm in my 7th day of self-isolation and looking forward to seeing the community after all of that period is through. So without further ado, I want to start by first of all saying thank you for attending. This is very important to us. But I also want to introduce our panelists to you this afternoon. The first is Elizabeth Yeo, our Vice President Students. Thank you, Elizabeth. Murray Kite, our Vice President Advancement. Murray. Andrew Beckett, our Vice President Finance and Administration. Kevin Walmsley, Academic Vice President and Provost. Thank you, Kevin. Laurie Boucher, our Mayor of Antigonish. Hi, Laurie. And Owen McCarran, Warden, Town of Antigonish. Welcome all. And I'd also like to introduce Mary Jessie McClellan, who will serve as our moderator for this afternoon's session. This will be the first of several sessions that we've planned. The second one will be at 6:30 this afternoon, and each one of them will run for about 90 minutes. We will have more community sessions as we go forward, but this is the first of what should be an extensive consultation with the township and beyond. A few housekeeping measures just to introduce to you before we get thoroughly underway. Questions, as you have them, should be submitted using the question and answer function rather than the chat function of this Zoom type technology. I see we have 204 individuals, now 5 on the call, so please, if you could look at that question and answer function. I would also like to ask you to hold your questions until the presentations are complete, and there's just going to be a few minutes of presentations at the start, as the answers you're looking for may be covered in what we're about to be seeing. We've booked this for 90 minutes, and we're going to be very respectful of your time. We will run for that 90 minutes, and we'll try and answer as many questions as we possibly can within that period. So again, thank you. And let me start by describing some of our journey with you so far. The team have been working, and that's the team at St. FX, have been working extensively over a number of months in order to create a framework of planning that will enable the safe return of students to St. FX and into the community. We've had various conversations with community in various aspects of it. We've worked well, not only with our people on campus, students, faculty, staff. We've talked to the town, the county. We've worked with health workers in order to come to a point where we submitted plans for the potential opening and return of students to Occupational Health and Safety Nova Scotia. And by extension, that goes to public health. We will meet and or exceed any expectation put forward by public health as we go forward. That is the basis on which we are going forward. The processes of approval internally was also very, very extensive. It went through our highest academic council. We call that Senate in the university. So faculty and staff have approved this way forward. And then it went to our board of governors in order for them to review the processes by which we came to a recommendation to bring students back to campus. Everything there has gone forward. And since that time, we didn't stop once our plans were internally approved and then approved by public health. We have had continued conversations with stakeholders in the community about how best to operate these plans. And we're mindful that the horizon with respect to COVID-19 is constantly changing, and our plans are written such that we can adapt to the needs of the community and beyond. So we have a flexible framework. We believe we've done a lot of work, but we're not finished in doing that. And we will continue these consultations to try and address concerns and worries that the community may have, and to listen very, very carefully. Although I'm new to Antigonish and to the university, I really understand that the basis of the university has been one in which we listen carefully to the needs of our extended community. It was a reason for being one of the great works out of the university is entitled For the People. We have not forgotten that, and that's in part why we're here today. So, the importance of community engagement with what we're doing, I cannot underline enough. It is such an important feature of what we're doing. If we work together to do this with protocols like wearing non-medical masks, safe social distancing, we will decrease the possibility of an event occurring. There is no risk scenario, no zero risk scenario in students returning. But let me say at the onset, there's one very important point I want to make to you. Whether we go completely online as an institution or whether we go straight to face, you can expect somewhere between 12 and 1,500 students to return to the community. This is where they live, and this is where they'll be if they're going to be online. So we will be vigilant, and we will work with you in order to create the safest possible environment, knowing that there is nothing that we can do that will be zero risk moving forward. Having said that, I want to turn it over to my colleague Elizabeth to give an overview of some of the plans that we've put together to give you a better understanding of our preparedness for bringing these students back. Elizabeth.
Thank you, Andy. Good afternoon, everyone. I'm really glad to be here to speak to you today. And like Andy, I also joined the Antigonish community as I started this new position in January, and just last month became a permanent resident of Williams Point. My husband's from Antigonish, and he and we are thrilled to be moving home. So over the course of the next 7 to 10 minutes, I'll try to keep it short because we want to leave lots of time for questions. I'll be highlighting the work that's been happening to date to prepare for a healthy and safe environment for our students and also for the residents of the town of Antigonish. As Andy has said, this plan is fluid, and that's in recognition that the public health protocols will continue to evolve, as will our administrative controls as we learn and understand the impact on community. And that's an important purpose of our meeting here today, is to better understand your concerns. So I'll move to the next slide, the first slide, which is an overview of the plan. So we have shared all of our detailed plans with you, the return to campus plan for students, as well as the return to campus plan for staff, our return to research, and our plans are becoming progressively more detailed as we get closer to September. And so those are shared on the COVID-19 website. I hope you'll all take the chance to look at them. They do answer a lot of questions that many people have been having. This plan is the return to campus for students plan, and it includes general protocols. So an overview of the health and safety requirements that we will be setting in place for our students. It also covers the residence reopening plan, a plan for the safe return of our off-campus students, a student wellness and student experience plan, as well as a communication plan to support all of the work that we're doing and need to do to ensure that everyone is aware and informed of these measures. Today, just for the purpose of brevity, I'll be focusing on the protocols and the plans for off-campus students. However, if you have questions about any other aspects of the planning, I or my colleagues will be pleased to answer them. These plans have met or exceeded the requirements of public health and safety and occupational health and safety. So the general protocols is the next slide, and we have established 7 of them. The first protocol is to be symptom-free. So this protocol means that students are to monitor their symptoms daily, to self-isolate and call 811 immediately when they are symptomatic. We will be providing constant daily reminders of this protocol. The second is that we will establish a robust communication plan to support diligent hygiene. We'll emphasize the importance of hand washing, and we will be providing hand washing sanitization stations around campus and disinfecting wipes within the facilities. We are significantly increasing the cleaning of the campus. The third requirement is to maintain physical distancing, and we have organized the campus to maximize and to permit the physical distancing. So that's been adjustments to classrooms, offices, and other campus spaces. Non-medical masks will be required of everyone on campus, and Dr. Strangs recently strongly recommended wearing of masks, and I understand that the town of Antigonish is also looking into this. Such an advance would vastly support St. FX's ability to enforce mask wearing off campus. We have a protocol to limit interaction where possible. Our services have options for virtual delivery. All campus events and gatherings will respect the maximum gathering sizes. We will educate our students about these required behaviors on and off campus. So we know that practicing physical distancing, wearing masks, diligent hygiene, and enhanced cleaning are effective ways to prevent the spread of this disease. If despite these measures, and if a student does get sick, we are supporting students so that we can prevent community spread. For those students and residents, we will provide accommodations and care so that they can isolate and quarantine if necessary. Public health will do contact tracing so that we can also isolate other individuals who have been exposed. By getting COVID-19 positive students quickly out of circulation, we can minimize the risk of the spread of the virus. As Andy mentioned, a significant factor in the decision to resume the face-to-face offerings is that many students will return to Antigonish, regardless of whether we return to an online environment or not. So the students have leases, and as citizens, they must be responsible to adhere to community standards and to be held accountable if they are not. We believe that we can much better influence this group's awareness and adherence to public safety and health protocols when they are present with us on campus. And this brings me to the 7th protocol, which is respect and care for yourself, your peers, and your community. As part of their registration process, St. FX asked every one of our students to personally commit in writing to practice the protocols and to exercise behaviors that exemplify our community values during this time of a pandemic. And to emphasize the seriousness of this, our Senate has added the failure to abide by the university's pandemic measures or any of the municipal, provincial, or federal laws to be considered a major offense under the St. FX Community Code of Conduct. We will increase the awareness of the protocols and the substantial penalties for not following the protocols. To this end, we've held several good working meetings with the town and county leadership, representative landlords, and the RCMP in preparation for the fall. And we are committed to working together to educate and enforce the protocols. The penalties for non-compliance are severe, both on and off campus. And this is one of the things that is different. In the past, the RCMP has always had the ability to fine for excessive noise. Under the pandemic, the RCMP can fine students $1,000 per person for failing to physical distance and for exceeding maximum gathering sizes. The other aspect of this that is different is that the RCMP will notify St. FX when they respond to a call that results in a charge or summary offense ticket issued to a student. St. FX will follow up with the student and may impose additional outcomes such as probation, loss of student privileges, and even suspension from the university. So the next slide talks about reporting concerns. So we know that, the students are in community, they're your neighbors, and you will be sometimes the first people who will be in a position to raise a concern if you see one. So any student, any staff, faculty, or community member can report concerns where they believe the public health regulations or these guidelines are not being followed. To report a concern for an issue you'd like addressed in the moment, such as if you suspect that maximum gathering sizes are being exceeded, you can call the RCMP at the number listed on the slide. To report a concern directly to the university, you can contact our Director of Student Life, Jacqueline Delibig, and the number is given there on the slide. So the next slide outlines more details about the plan for our safe return of off-campus students. We recognize that it is in the best interests of the campus and the community to support any off-campus student who must adhere to a 14-day isolation period. To help with this process, or to manage it, we will require off-campus students to submit a plan to return to the community and for self-isolation if that is required. For students who are required to self-isolate, the university will assign a local support person who will check in regularly as well as assist with groceries and other needs. We've been delighted to have offers from our students who are already here, from our faculty and staff, and from members of the Antigonish community who've already reached out to offer to assist students during self-isolation. And if you would like to get involved and help out, please contact Jacqueline DeLebick, and her information has been provided. So off-campus students who are not required to isolate or who have completed the isolation period will be issued a green wrist bracelet. The green bracelet also signifies that the student has committed to follow the community protocols. So the community can be assured that the awareness is there and the student has made that commitment. And one of the questions suggested is, could we issue a different colored bracelet to students who are in their period of self-isolation? And we will take that back and look into that. That seems like a sensible idea. So we will look into operationalizing that. For the month of September 2020, all students must have a green bracelet to enter any academic or administrative building on campus. So the next slide talks about student wellness and the student experience. So we recognize that there are risks for students to be on campus and in community, but there are also risks associated, which would involve with not moving forward and giving them an opportunity to return to campus. And that includes elevated physical and mental health risks that can result from extended periods of physical and social isolation. So it is critically important to note that our approach will balance rules and enforcement with education, appealing to responsibility and community spirit, and providing healthy and positive alternatives. And this is being worked on in collaboration with the student leadership of St. FX. We are both working very hard to develop new approaches to support student wellness and the student experience. For example, we're introducing new programming to educate students concerning substance abuse and providing safer partying guidelines that are compliant with public health. We are taking extra measures to support student mental health and build resilience. And we are going to maximize this beautiful part of the world by getting our students outside to enhance stress reduction and wellness programs offerings. For example, the CAPIC has already approached us to partner on outdoor initiatives. And we welcome the chance to work with any community partner who have ideas and want to get involved. And if you are interested, please get in touch with Jacqueline DeLebick or myself directly. The next slide speaks to communications, and we are implementing multiple communications with students concerning their expectations and commitments. There will be challenges to overcome this year. However, the risk mitigation strategy is robust, and we do feel that with a combined approach of the university with local community members, we can achieve the outcomes that are needed. That concludes my overview, and I and my colleagues will be pleased to respond to your questions.
Thank you very much, Elizabeth. That's much appreciated. At this point, I know there are a lot of questions already supplied to us, and so I'm going to hand it over to MJ McClellan now to moderate that part of the session. MJ.
Thanks so much, Dr. Haken. There have been a number of questions posed online or posed in our email inbox, so I'll start off with those. Unfortunately, I would just like to remind everyone that it may be difficult to respond to all of the questions during the time we have allotted. We want to balance the questions that were posed in advance as well as the questions that have been posed online. So we will, however, capture all of the questions posed and pose the questions and their responses online on our website, www.stfx.ca/community within the coming week or so. So let's start in with some questions. The first one, how do you plan on monitoring off-campus students?
Thank you, MJ. I'll start with that. Elizabeth has already given a quick overview, but I'm going to hand it back to her in a second. But as her slides indicated, the success part of monitoring off-campus students will be one of vigilance and help from the community to understand what is going on. We need to know what's going on in order to respond. That is a partnership we have to have with you moving forward. But I'm going to let Elizabeth talk a little bit more about the details associated with what we will be doing.
Thank you, Andy. So this is where the partnership and collaboration with community becomes vitally important. And we have had a number of meetings with the town individual who oversees the bylaw enforcement process, as well as the RCMP and the landlords. And we are working together to create a collaboration that's going to support us in our ability to monitor the students' behavior off campus. So along with providing students proactively with communications, we are creating a new Good Neighbors Guide. We're working with the landlords to be ensuring that the landlords are also having the discussions with their tenants about what the expectations are for students who are living in community. We will be working with the RCMP, as I mentioned earlier. So when students are called, are fined, or there are summary fines offered, we will be following that up. And we have already started doing that in recent weeks. So that's something that is going to, again, as Andy said, will really rely on that collaborative approach and working together. But I'm very confident that we will be able to achieve great results by doing so. And I think the other aspect of this as well that's really important to remember is that it's not just about the enforcement. A lot of this is going to be about education and reminding our students that they are members of the community. Our students are very community minded. You all know this. They contribute countless volunteer hours to our community. They coach our soccer teams. They're active in so many ways in the community. And those community minded young people, students of all ages, are not going to lose that community-minded spirit. So we will be educating students and appealing to that community spirit, as well as ramping it up on the enforcement side and our collaboration with the town.
Thank you, Elizabeth.
Great, thanks so much. What responsibility will St. FX take if a student has COVID or does contract COVID?
And let me start this one off as well. We'll take our responsibilities very seriously here. And our key one is to work very closely with the regional health officer to understand the nature of any student who contracts COVID moving forward. We will work in partnership with our regional health officer, and they will then mobilize Nova Scotia Health and, if necessary, local physicians in order to move into how to handle what may be an outbreak, maybe an isolated case. But we have understood that our role forward is to work very carefully with the regional health officer. Elizabeth, again, I'm going to turn to you to put some more meat on the...
Thank you, Andy. So a significant part of the plan is basically how we are going to be working with our students. So for this reason, we have within our own facilities, so the students who are staying on campus with us, we have set aside facilities for students who are required to self-isolate and quarantine. And so we will be able to very quickly move students out of circulation. We have provisions to take care of the students when they are under our care in isolation and quarantine. So that will provide a lot of support for students, individualized support for meals, for check-ins, for monitoring. So that's an important piece of it. Are those extra facilities. And then, of course, as Andy said, we are working diligently with the health authority in terms of taking extra steps to react very quickly. So, for example, we are in discussions concerning the opportunity to establish a primary assessment center on campus. So the province had already discussed the possibility of mobile testing centers, units that could come to campus on a regular basis for testing. So we are actively working to establish those extra services so that we can respond again really quickly and get the students out of circulation as fast as we can, and then provide some supports for their care.
Thanks, Elizabeth.
How exactly will you discipline the students who do not follow the protocols?
Mm-hmm.
Thank you. That is a great question. Again, touched upon in Elizabeth's presentation, but I'm going to turn to Kevin to talk a little bit more about this in a second. Essentially, we recognize that these are extraordinary times, and some of the measures we've put in place are extraordinary in nature. And it required us going back to our Senate in order to look at pathways by which we could construct a better guideline for the behavior of students. So with that intro, I'm going to hand it over to Dr. Walmsley.
Thank you very much. Good afternoon, everyone. That's a very good question because it's one of the items that people are most concerned about, including the province, with students returning to campus. And everyone is aware that students have a nightlife like everybody else. And of course, they're concerned about alcohol and what effect that alcohol can have on a student's decision-making capacity with respect to distancing and wearing masks, etc. So as Andy mentioned, we brought our protocols to the Senate, and all of the pandemic-related behaviors are now part of the Student Code of Conduct. So our approach to student behavior is multi-layered, and it is in working in cooperation with the RCMP. And so all of the legal protocols apply to every instance of behavior with every student. And so that's a $1,000 fine per student when these behaviors, as outlined by law, are broken. In addition to that, now these behaviors are directly tied to our Student Code of Conduct. So that can result directly in a suspension, in a warning, in a suspension, or an expulsion from the university. And this comes at a very severe cost for individuals, and all of our students will be well aware of these protocols before they arrive. So they know that if they don't follow these protocols and they are participating in risky behavior and placing others at risk, that they will be subject to penalties. And that could mean leaving their tuition fees and their residence fees behind. And those are significant amounts of money. And as you know, the $1,000 fine is a significant amount of money. And students face financial challenges to attend university. And so these can be very effective means of having students adhere to behavior.
Thank you, Kevin.
Did the university consider the impact on St. Martha's Hospital?
That's a great question. And again, I'm going to turn to my colleague Elizabeth, as she has been the member of the executive team who has really tried to spearhead our work with the health community in order to produce this framework of planning. Elizabeth.
Thanks, Andy. So as mentioned, and what some people may not know, actually, this hasn't been mentioned, is that St. FX does have a clinic on campus. So we are staffed by one full-time physician as well as 2 nurses. And so they are able to take many of the students who will be, who are ill, like on a day-to-day basis. That is where many of them do go. The other aspect of that is that we are also working with the health authority to explore options such as providing access to some of the new virtual services that have become quite common and well used since the onset of COVID in March. So the virtual care that has been happening with patients, we are exploring ways that we can be connecting our students with some of those opportunities. I've already mentioned the primary assessment center or the mobile testing units as a way to ensure that we are not putting increased load on St. Martha's Hospital. Other things that we are doing is recognizing that flu and cold, the regular flu and cold season is coming, is advocating with public health to step up their work with us on the campus with vaccination clinics and promotion around the regular cold and flu season. So that will also reduce load on both St. Martha's as well as on our own healthcare facilities. I think another consideration that's important to keep in mind with all of the additional cleaning and healthcare and health requirements, the cleaning, the wearing of masks, physical distancing, this is not only going to be preventing the onset of COVID, we should have a knock-on effect in terms of our students who are contracting the normal contagious upper respiratory infections. So that's something else to keep in mind. But even with that in mind, we are also in discussion around looking at ways, again, with the health authority of having an upper respiratory clinic within our own clinic. Again, all of these measures being taken to ensure that our students are not having an impact on the healthcare facilities at St. Martha's, wherever we can do so. Again, recognizing that our students are also community members and that is a resource that they have accessed in the past. And so it's important to recognize that we're probably not going to be able to take all of that away, because the situation is the same as it has been in the past, in that, you know, we have used these facilities in the past, and as our students are members of that community.
Just one small piece to add to that, thanks Elizabeth, is that we have an ongoing dialogue with local physicians. Indeed, we'll be having a meeting with some of the physicians on July 20th, and there'll be representatives from Nova Scotia Health at that one as well. So as I said in commencing this town hall meeting, the dialogue is ongoing and the planning process is ongoing, and we will shift in order to best accommodate the resources that are available and the needs of the community as we go forward. So thank you for that. And MJ, our next question, please.
Okay. The next question is, will you be sharing your pandemic planning within the community?
Part of what we're doing now is to indicate to you what our plans look like. And I believe as we came into the town hall, we shared our planning framework. And this is a key part. Everything we do in terms of our framework, we want to share, because without your support and collaboration, we know we're going to be up against it. We need people to work with us in order to work with some of the protocols. The use of non-medical masks, the use of social distancing are key elements of the planning that we have. And that doesn't just mean on the Centreflex campus. That means when we're out and about in the local community, that we respect each other's space, that we try and prevent this contagion through breath by wearing that non-medical mask, that we're mindful of the symptoms that are shown to be aligned with COVID-19, that we do regular self-checks. This is the way that we work together. It is no one body's responsibility. It is a collective responsibility of our community. And I think that will be a key for us moving forward. So in terms of sharing our plans, I'm going to talk a little, hand it over to Murray to talk a little bit more about communication. Murray.
I'm mute here. Well, thanks, Andy. As Liz has really emphasized, there are a number of key stakeholders, students being a critical part, and then the community. And the communications plan is multi-layered, but let me just speak a little bit about the community. These town halls are critical, and plans to have more. We wanted to start them as soon as we had the joint council meetings with both the town and the county. We have our medical meetings that are ongoing, And we knew that the information had to be disseminated among the local and county residents. And as I said, this plays a part of it, and it will continue. And we hope moving forward with the Good Neighbors Guide or protocols that we have, that we could help the community understand the level of commitment that our students will be pledging to be a member of the Centefex community. And I think that will go a long way. But we have, if internet access is great, you can go to our website. For those of you that are joining the call, all the documents are online and as part of this information session, but we do have a really good website with regards to all our plans. And they're updated regularly. We have a pretty robust, frequently asked questions for our students and community members. But we will be providing opportunities to push out that information in various forms. And we realize not everybody is connected through the internet, and we're looking at various ways to get that information to those community folks. So the real emphasis has been on our students, particularly our off-campus students, and then getting the information out to our community members in the various facets and plans that Liz has already alluded to.
Thank you, Murray.
Thank you. The university will perform random checks on students living off campus during the 14-day isolation period to promote adherence to guidelines. What part of the town's budget is allocated for this, and who is assigned to make it all happen?
Maybe we'll start by talking a little bit about that random testing, and then we can go to both Mayor Boucher and to Andrew Beckett for some answers. Elizabeth, would you like to start that off, just about the random testing part?
Sure. So, so with the testing, so right now we're looking at a standard of at least a number of times, multiple times during the 2-week isolation period. But it's important to remember that the province also has new protocols that were recently introduced. So the province is following up with students who are required to self-isolate daily. So what we will be doing will be, on top of that. So the province is leaning into that piece. So, and the other thing that I'd like to emphasize, I think in the last few minutes, maybe in my presentation, I've talked about working with the town. I think it's really important to note that many of our students are engaged with the county, and we are also working very actively with the county and those constituents as well. So working to ensure that we're also extending our reach for all of these protocols, both in the town as well as our residents of the county.
Thank you, Elizabeth. Over to Mayor Boucher. Mute is on.
Thank you very much, Dr. Henkin. Once this decision was made, we have committed to being part of the process to make sure that we can mitigate any dangers to the community. We want to ensure that all the protocols are being followed, enforcement is properly followed through and done in a consistent manner. Our actions as a town will demonstrate our commitment to the safety and the protection of our citizens and to ensure that proper information has been shared in a timely manner. Besides myself, the CEO, the Director of Community Development, our bylaw, and our Marketing and Communications Officer, we will all be involved on an ongoing basis to make sure that we can mitigate any risk to the town and to the residents. We do have, although we don't have a line budget for this, we do have a COVID contingency line, and we are committed to we are able to access additional resources as needed to make sure that the community is safe.
Warden McCarran, is there anything you'd like to add to that?
Thank you very much, and thanks for the opportunity. We as well will be watching and working closely with the town as things start to unfold, and obviously the bulk of the population resides within the town, and we acknowledge that, but certainly we want to make sure each component of our communities are safe, and we'll be keeping a close eye as things unfold.
Thank you very much. Andrew, perhaps just an indication of the extraordinary measures we're going to in terms of supporting some of the additional pieces we're putting in place.
Thanks very much, Andy, and good afternoon, everybody. Safe to say that in terms of making a decision like accepting students back on campus in the fall, it comes with a significant obligation in terms of what we're doing to support that, and Elizabeth and others have outlined some of those measures. The specific questions around budget, and it goes well beyond what we're doing for monitoring students during a 14-day self-isolation period, which, quite frankly, a lot of that will be done through volunteer efforts. And we've already had a good number of people come forward and offer their support and assistance during that time. But we're also putting in place a lot of measures on campus, a lot of changes. Things like our residences, for example, will not be the same as in the past. We're going to have no double rooms. They'll all be single rooms. There's increased sanitization and cleaning protocols going to be in place on campus. The capacity of our classroom spaces are all going to respect social distancing. We're providing non-surgical masks to our staff. We'll be providing some to our students as well. And Elizabeth talked about a number of other support mechanisms that we're putting in place generally throughout the year. In terms of a total tally for the university, I will be quite honest and say that that's an emerging exercise right now. I would suggest that we're already coming very close, somewhere in the $2 to $3 million range, in terms of expenses that we're incurring to support the return to students on campus. And we have not at this time put stringent controls in terms of how far that expenditure goes. This is about providing a safe and healthy living and learning environment that supports our campus and the community. And we know that we've got a significant part to play in terms of making that happen, and we're committing the resources that we think will help provide that sort of support going forward.
Thank you. What percentage of St. FX students are actually not domestic? So what percentage do we have of students that are not from Canada?
That's a question likely best handled by Dr. Walmsley. Kevin.
Thank you very much. Good question. I will add a piece to that because I know that there's a place that's very near to the near and dear to the hearts of Antigonish and county members, and that's the Coady Institute, where through the decades we've had so many visitors from many countries around the world, and I'm sorry to say that because of the pandemic, we will not be having any of our Coady international visitors this year. Their programs will be completely online. With respect to the St. FX population, approximately 7.2% of our student population in a normal year is non-domestic from the United States and about 43 different countries from around the world. But this year, the federal government has not relaxed its borders, and as of today, we don't anticipate any international students arriving from beyond the Canadian border. Now that could change, and the federal government may consider relaxing that, but if that happens, St. FX must follow all of the protocols that are required for self-isolation, and we must have the facilities available for self-isolation for these students as we would for any other students. But I will say from our survey this week of our international students, we have 123 that remained in Canada. The majority of those students remained in Antigonish. Some of them stayed on campus, and the others are living in their houses in Antigonish as members of the community, and very happy to say that 123 plan to be back, and the majority of those will not need to be isolated.
Thank you, Kevin. That's appreciated. MJ.
What plans are in place for the protection of university staff members and their families if they are exposed to COVID-19?
Let me start by saying that we have a phased arrangement to our planning framework to reopen the campus, and we're already well into that. The planned return to work in the first phase 1 sees approximately 30% of our staff return to work. In terms of return to research, which is a major exercise within the university, very careful plans were also put together for that. But I'm going to turn it over to Andrew Beckett to give you a better overview of our planning with respect to the return to work, our staff members and their families. Andrew.
All right, got to make sure I hit the right button here. As Dr. Aiken said, we are taking a phased approach. We're just about finished phase 1, which was an attempt to return about 30% of our workforce to campus and really start to build the culture that we need to support a safe campus going forward. And a big part of that was to get a core group of staff used to things like the physical distancing protocols, used to wearing masks when they're around campus. And we're just about finished phase 1. We think we'll be able to move to phase 2 possibly as soon as next week, which we'll see a few more people coming in. As part of these phases, though, a key part of it is we're doing risk assessments throughout all of the buildings on campus to take a look at what needs to be put in place to protect our faculty and staff in various activities that they're taking part in on campus. So, for example, in our classrooms, depending on the type of classroom, we're looking at a variety of different options that may be available, whether it's establishing guidelines in terms of the distance that's to be respected between faculty members and staff that would be greater than the 2 meters, just to provide that added layer of protection for our staff. But right through to the potential of having, for example, movable plexiglass barriers that could be put in place if there's not an opportunity to maintain the physical distancing. At the end of the day, we're required to meet the strictest of occupational health and safety standards in terms of establishing a safe campus and a safe learning environment. Our plans are being reviewed by the Occupational Health and Safety Division of Labor and Advanced Education. And we have made it clear that we will respect and meet the obligations that we have to provide a safe living and learning environment.
Thank you, Andrew. MJ.
So this is a statement from a listener. You can say that regardless if St. FX is fully online or in person, that 5,000 students will still come to Antigonish. This is false. I'm certain that like other post-secondary institutions, students would rather stay at home with no expenses and continue their learning rather than move across the province, the country, or the world to be in Antigonish to attend virtual classes. There is no doubt that some programs do require in-person attendance, but the majority do not. Since a task force was created when the pandemic began, what progress have they made in preparing for an online semester? There is no good reason to bring 100% of the student base back to Antigonish.
Thank you for that comment. Let me start by just correcting that first number. The number I said at the beginning was between 1,200 and 1,500 students would be living in Antigonish, whether we were online or face-to-face, not the full 5,000. I agree that if we were fully online, then some would not return to Antigonish. That's right. But I'm going to hand it over, first of all, to our Provost and Vice President Academic in order to talk about our learning experience at St. FX and why we believe it's important to bring our students back. Kevin.
Thank you very much. Excellent question. And so let's start when we began in late March with the planning for a return to September. And it was an open-ended question. And so we looked at many different models that could be employed for September. And we weren't bent on establishing any particular model because each had its own caveats. And so that's why the first thing that we did was we struck a task force because we had just sent students home and we had moved online. And it is our responsibility to provide the highest quality of education possible for our students. And there are some things that we are very good at, and it's understood that we are a residential university We have been for more than 100 years, and we are best in the classroom face-to-face. That being said, however, if we're required to be online as we were in March on our decision, we want to provide a very high quality education. And so we struck a task force of our peers, our professors, to assist in moving online and providing the best experience possible. This didn't happen in a vacuum. We were assisted by the Maple League of Universities, which includes Acadia, St. FX, Bishops, and Mount Allison. And they were working weekly and providing professional development for our professors and providing the best opportunities for our professors to become professionally trained to offer high quality online experiences. And so as time went on, we also looked at face-to-face models and a combination of mixed methods teaching, which is to be on campus, but also to have some online courses while you're here and to have both models in a particular course, as well as continuing to prepare for the fact that we may have had to be online in the fall. And so all of these plans together, and they required the Chief Medical Officer of Health to approve the plans. That is the reason why we chose face-to-face, because we were given approval under the very strict conditions that we established for having face-to-face classes. That being said, we also asked our professors what they wanted to do and what was the best method for them and how they felt about delivering courses. And it turned out that we constructed a timetable very carefully that is about 70 to 71% of in-person classes, the rest being online. Our task force continues to work on preparing our professors to be online, should that be necessary. And our professors have been instructed to be aware of the platforms necessary to deliver their courses in case there is a change in direction at any time. And so we are fully prepared for any change of direction as we would be told by public health. But rest assured that public health is not necessarily interested in a full shutdown of institutions should an outbreak or a so-called second wave occur. Dr. Strang is interested in a more measured approach and a case-by-case basis where communities would manage this individually and is not particularly interested in seeing the province shut down again. So we will proceed with caution, and we are very good at face-to-face learning. And all of these protocols, as Andrew has said, have been put in place with distancing in the classroom, with traffic flows that look just like the grocery store and the liquor store. All the students are required to wear masks on campus, on the way to class, on the way to the meal hall, and as they sit through every course. And all of the office hours that will be held will be virtual. And so our faculty and staff are protected, our students are protected, and we believe that these protocols will well infiltrate our community as our students move about through the community. And so that is why we made our decision, because we found out from public health that the choices that we made to provide a face-to-face education were safe. And that's why we proceeded in that way.
Thank you, Dr. Walmsley. MJ.
A significant outbreak of COVID-19 is possible. What do you see as the role and responsibility of the university in the event of an outbreak of this illness?
Thank you. Another great question. We partially covered that in one of our previous answers, but our responsibility is really to be proactive in what we see and do. And that is to work very carefully with the regional health officer in order to activate the public health system to a response via Nova Scotia Health. Now, that's the bare bones, but maybe I could get Elizabeth to reiterate some of the pieces that we're planning.
Sure. So essentially, we have put in place extensive measures, in particular for our students who are living with us on campus. So if students on campus become ill, many of them will be in accommodations where they can isolate in place or quarantine in place. And we have established the safety protocols to enable that to happen in a safe way. So we will be able to accommodate those students on campus. For students who are in a facility where there is, I think, a little bit more difficulty to access a separate washroom facility. We are providing separate facilities, separate rooms that will enable them to quarantine and isolate safely. For all students who are ill or in isolation, we will assign a case manager to care for their needs. And they will be providing their food delivery, they will be providing for monitoring and check-in, and essentially whatever they need for their care is going to be provided for them on campus. So I think that's a really important consideration. I'm not a medical professional, obviously, but I've been really grateful for the support of colleagues in the medical profession to help us work through many of these really critical questions that we have to get this right. And we've had a lot of expert support to figure out ways to do that. So with that, we understand that the majority of students who fall within this age group, if they are infected with the COVID-19 virus, many of them symptoms will be in the mild to moderate category. So we're anticipating that we will be able to care for the vast majority of students who, if there were to be an outbreak on campus, obviously, with the hygiene measures and all of the safety measures that we're putting in place, our plan is to mitigate that as much as we can. But if an outbreak does happen or an individual student becomes ill, I'm very confident that we can provide the care for them. And then just to reiterate what Andy was saying around our responsibility to work with our local healthcare authority and public health to be, over the course of the coming months, to be finding ways to augment the resources that we have available on campus wherever possible, so that we can ensure that we're avoiding sending students to St. Martha's to access care wherever we can. And those are ongoing discussions that we have been having.
Thanks, Elizabeth.
There has been a lot of talk about the expectations for students. What expectations are in place for faculty, staff, and administration?
Thank you. Yeah, as I mentioned in a previous question, we have got extensive plans in place in which we've been very clear about the types of protocols that we're putting in place for return of workers on campus, faculty and staff. I'm going to first turn to Kevin to give an overview of what we're doing with respect to faculty. Then I'm going to turn to Andrew Beckett in order to have a description of the measures we've got in place for staff. Dr. Walmsley.
Thank you. So as Dr. Haken has just explained, as Andrew Beckett has explained, we're in the process of welcoming some of our staff members back to work. However, the majority of our faculty members are working from home, and they have been since the middle of March, with the exception of some researchers who have moved operations back to campus. As people move back to campus, all of the health protocols apply to every individual that works at this university. And that includes any protocols for masks, any protocols for physical distancing, and any protocols for cleaning will be applied to all of the infrastructure of the campus. And that includes all of the teaching and learning spaces, including any informal learning spaces, all of the work areas where our professors and staff are, any of the laboratories, etc. And so I think that the easiest way to answer the question is to say every protocol must be met or exceeded with respect to standards when it comes to faculty and staff. The distancing will be in place. The office hours will be virtual. We will take every measure to ensure that our faculty and staff are safe. And of course, we've already spoken about our students. And when we put it all together, that means that all of our community members on this campus will follow every one of those protocols.
Thank you, Dr. Walmsley. Andrew, is there anything you'd like to add to that?
Not really. I think Kevin covered it very well. I think the easy answer to the question is the same expectations that we have of our students, we've got of our faculty and staff. This is a shared risk exercise that everybody needs to play a part in. So the protocols around doing the self-health checks on a daily basis, practicing diligent hygiene, maintaining physical distancing, maintaining proximity work, but where that's not possible, wearing the proper protective equipment, wearing non-surgical masks at all times around campus, limited interactions, so a lot of virtual meetings like Kevin talked about, and that respect and care for yourself, your colleagues, and your community that we're trying to push with our students. That also applies to our faculty and staff members as well.
Thank you, Andrew. MJ.
How frequently will washrooms be disinfected in residence while a student is self-isolating?
I'll turn that back to Andrew straight away on that one, and maybe Elizabeth has a commentary on that as well.
Sure. Just to give people a sense, we're looking at about, in round numbers, about 1,500 beds that we've got available on campus. And as I mentioned earlier, they're all single rooms. About half of those rooms have private washrooms. And as is always the case with those rooms, the cleaning of those rooms, the washrooms in those rooms is the resident's responsibility. But they are private, and that will cut down any risk of any sort of crossover contamination that might take place. Although I would point out that all the current information is there's been no transmission of the virus through washrooms at this point in time. In terms of the cleaning of shared washroom spaces, we are increasing the frequency of cleaning and sanitization of all the high-touch areas in residences and other buildings on campus, and that would include the washroom spaces, and we're establishing the protocols that are needed in those places. Part of the way that we're mitigating risk in this area, though, is really reducing the number of students that are using shared washrooms, and that's achieved in large part by the lower density with the removal of double rooms.
Great. We know that there are rental homes in the town and county which may be subpar, including poor air circulation and other issues, which can increase the risk of contraction of COVID-19 to our students. What is the university, the town, or the county doing to remedy those situations? Dr. Haken, I think your mic is muted.
My apologies. I'm going to turn to our mayor, first of all, to start with that, and then I'll come back to Elizabeth, who has been working with the Landlords Association as well.
Yeah, we do have difficulty. We don't have the ability just to go into any resident and do an inspection, but over the last couple of years, we have been working our bylaw enforcement officer, and Steve Scannell has been working with the landlords working with the university to let the students know that they do have some ability to report problems. Just like the university doesn't know about problems that are happening in the town unless they're reported, we don't know some of the conditions of the houses unless it's reported to us. So we are able to take action once they are reported to us. So that's what I would ask. It's an ongoing communication between our office and the students, and we want them to know that they do have some ability to report problems to our building inspector and our fire inspector to make sure that all the codes are up to date and up to par.
Thank you, Your Worship. Elizabeth, anything to add?
Just that I will note that we've been working with some representative members of the Landlords Association to date, and the discussions have been primarily on, what do we need to do to get ready for COVID-19 this fall? So that's really been the scope of the work, and we have been working with them and have arrived at that we will produce the Good Neighbor Guide and make it available to our Landlords Association with some information and tips on how they can be supporting us to do the work that we need to do in community. And we have offered a town hall specific for the Landlords Association, so we're still waiting to hear if they would be interested in doing that. So again, the scope of our work so far has been around COVID-19 measures.
Thank you, Elizabeth.
Will you allow outdoor time for resident students while they are in a 14-day isolation period, as residents' rooms are tiny and mental stress will be an issue?
Yeah, we've taken very seriously some of the parameters that can affect the mental health of our students. And I know Elizabeth has worked extensively on this area. So over to you again, Elizabeth.
Thank you. That's an excellent consideration. So we actually have the question in with public health right now to get some really specific guidelines on what we are able to allow the students to do. And we have a number of things proposed that we would like to allow the students to do while they're with us in residence for self-isolation. So please stay tuned. We're creating a tip sheet for students who have to come from out of the Atlantic region and self-isolate with us. So all of these details will be answered in that tip sheet because we get the same questions are coming up again and again. So as soon as we know, we'll share that with you.
Thank you.
Okay. Will there be someone dedicated from the university to visit homes to ensure that students are isolated?
Part of our strategy is to have checkup on our students in the community. And I think Elizabeth touched on this before, but maybe Elizabeth, you could go back to that point and reaffirm it.
So yes, when the students are arriving with us in September for their period of self-isolation, we will be assigning an individual to be their support person who can be there to bring them food if they need it, to bring them supplies, to check in on them regularly for the purpose of just supporting them, as well as for the purpose of, making sure that they are aligning. And again, public health is going to be doing extensive monitoring, as is right now anyway. They are doing extensive monitoring of students and any individual who is required to self-isolate.
Yeah, just to confirm for people, I mean, I'm under self-isolation myself, and entering into the province via Halifax Airport, I had to fill out a number of forms to indicate where I'd be living and where I would be for the whole period of the 14-day isolation period. Now that meant giving my mobile phone, and that means that at any random time I could be called to check upon my whereabouts. If there is no pickup for 3 separate calls, then I will expect an RCMP officer at my door. So again, working in conjunction with the measures already in place by public health and our own due diligence, once the students are here, we will find ways in order to ensure that our community is looked after.
Great, thank you. This question is in regard to immunocompromised students and what accommodations are being made for them, particularly in residence and those who are off campus when they come to campus, like when they then are on campus for class.
Elizabeth, again, your portfolio on this one.
Mine, and I'll probably bounce it over to Kevin as well because he's been engaged with these discussions. So we are alive to the need of our immunocompromised students. And for students in residence, we have a process set up where through the residence manager, you can speak to the residence manager about the specific nature of your needs. We're aware that every person's situation is individual, and what is going to work for some students will not work for others. So it is a highly individualized process, but we are prepared to work with any student who has extra needs in this area. And so we would encourage you, if you are in residence, to get in touch with us and we can start to work through that process. So some examples of the kinds of things that we are able to do for you would be to ensure that we prioritized for a suite style residence where you do not have a shared washroom, that we can make arrangements for you to arrive perhaps after the other students have arrived, so that, and make sure that you are able to access your room in a way that minimizes contact. So there are many things that we can do to support you. And we would really want you to be an active participant in that process by telling us what you need to feel safe and what you need physically for your health to be safe. So that's what we are able to do in the residence. And I'll invite Kevin to speak to the academic side of things.
Thank you, Elizabeth. And you've hit the nail on the head. And I don't want to overstate the obvious, but we're a small institution. And that enables us to provide particular care to individuals on a case-by-case basis because of the number of students that we have. And so it enables us to personalize all of the care that we can take in our residences and in our academic programs. And that is the real cornerstone of education at St. FX, is looking after our students and their needs. And so we must consider that there's no standard form of immunoproblems for students. They're all different. And so we take each of these cases individually. And that goes with all kinds of different learning disabilities and challenges as well. And so we, for years, have been working with individual students and identifying their needs. And our professors who work in a small institution are focused upon the individual needs of their students. And they know them all by name. They know who they are, where they're from, and what their challenges are. And they've always been fully prepared to accommodate these students for whatever they need. So in the first instance, I would say, if there's a severe problem, it could be that those individuals may not wish to travel to Antigonish, which brings us back to our online learning capacity. And so it will be approximately 30% of our courses will be online. And you'll say, well, that's not enough. And the response to that is we have other resources. And so we have the Maple League of Universities that have access to online courses for students. And our deans and our academic advisors are prepared to deal with these students on a case-by-case basis to enable them to get the courses that they need or alternative courses that can take their place. In addition to that, we would provide letters of permission to other universities, and then we would make it possible for students to have transfer credits to move back to St. FX and finish their degrees. So our academic service personnel and our professors have full capacity to provide the necessary services and accommodations that our students need on an individual basis.
Thank you very much, Kevin.
Great.
Thank you.
There are a number of faculty who do not live in Antigonish year-round. What isolation protocols are in place for them?
Dr. Walmsley. Mute.
Mary Jessie, could you please repeat the question?
We have a number of faculty members who do not live in Antigonish year-round, and they're curious about the isolation protocols that would be in place for them.
Thanks very much. And so we need to return to Dr. Haken's original statements and some of the statements that we've all made. And that is every faculty member, every teaching faculty member that we're talking about here must adhere to the minimum health protocols of the province or exceed them in some cases. And so we recognize that we have an Atlantic bubble. And so if professors live outside of the community of Antigonish, they will be traveling back and forth just as our citizens are now and have been to work in the county and in the town. These students are just like, the students are just like citizens, and so are the professors. And so they are subject to the laws of the land and the requirements of health protocols. And you should know that our faculty members will not be traveling to conferences this fall. Travel has been suspended. We will not be hosting major events. And so people will not be coming to and fro to campus. And so the issue of travel is a very important one. And I'm glad that someone raised this question. And so all of our faculty members are subject to these protocols. If they live in Halifax, they can travel back and forth to teach because public health permits it.
Thank you, Dr. Walmsley.
So without consultation or permission, St. FX is asking the community to tattle on students for not following the rules that St. FX has created. That is their question.
Without consultation. Well, the piece about it is we're trying to create a safe environment for all. And that is a collective responsibility. We recognize that the majority of our students don't need to slavishly adhere to a new set of rules and protocols. They know what to do the right thing. We cannot guarantee that for every single student that comes back. Hence the need for this approach that we're doing. It's unfortunate, as I've said already today, these are extraordinary times, but we will protect our community to the best of our abilities, and that is part of what we're doing. In terms of consultation, our consultation with the students is ongoing, just like it is with every other group. We will sign very shortly a memorandum of understanding with our students that outlines the commitments each group are making to care for that safe environment. I'm going to hand it now to Elizabeth to embellish that a bit more.
Yeah, I mean, that's a great question. And at the end of the day, we know that the vast majority of our community will step up. It's who they are. Everyone has been through this really difficult time. Everyone knows the requirements of public health by now, and we're going to be doing a lot of communication to make sure that they know how it's going to work here in Antigonish and at St. Evax, because, you know, there will be that adjustment period. And so, but the awareness is already very high, and we are going to be building on that. Again, at the end of the day, we know that people will step up and do the right thing, but you know, there may be some outliers, or there will be people who make mistakes. I mean, there have been times like I've got 3 masks in my handbag, and sometimes I still am halfway into the store before I remember to put it on, and that's not going to be, we are going to be working really, really hard to get that so you remember it. And the more we can reinforce that message, the better it's going to be. So we will be working with our students to remind them of that constantly. But the other piece of it is that these are not random guidelines that we've dreamed up. These are the laws of our province. They are being enforced by the RCMP. And so in the case of when anyone has not been following the law, sometimes our citizens aren't sure what to do. So Dr. Strang, our public health leader, has advised, you know, if you feel comfortable, because it may be a mistake, the person just may not be aware. And so they are recommending, you know, if you feel comfortable, speak to the person and ask if they need help or ask if they need support. Maybe they're feeling like it's hard to get something that they need. So we're here to help them. And that's part of the reason for giving our name in that way. You can call on us to go and help the students if you have concerns. If you can speak to them yourself and offer your support. But then again, if all that fails and you're feeling unsafe because of the behavior of anyone in our community, you have the right to call the RCMP. And if that person in the community is also a student, our Senate has given us the authority to also follow up with that student. So that is essentially the answer to the question, in that we are asking for care and compassion. We're asking for people to step up and comply with the new requirements. And at the end of the day, they are the laws of our province.
Thank you, Elizabeth.
If students are under the threat of expulsion for being in close contact with others, can we trust them to be truthful when trying to do contact tracing?
I'm going to turn, first of all, Dr. Walmsley to re-emphasize that it's not a threat of expulsion, that it's a graduated risk table that we use, with the final part of repeated offences being expulsion. But I'm going to turn first to Dr. Walmsley just to re-emphasize that series of protocols we've put in place to deal with violation of protocols. Kevin.
Thank you. So the Code of Conduct deals with a number of different behaviors. And when it's pandemically related, of course, we have to look at all of the protocols that exist and expectations for student behavior. And as everyone understands, there are different grades. There are different ways to break this code. Some are very, very minor. Maybe you're not wearing a mask to class. Well, you're not going to be allowed in the classroom, for example. And so in the public, these kinds of offenses are just like offenses against the law. There are gradations, and our Code of Conduct works like that as well. You aren't immediately kicked out on a particular kind of behavior. It's a very carefully organized system. There are checks and balances, there are appeals. But yes, there could be expulsion if students are participating regularly and disobeying the protocols. Absolutely, there will be expulsions. But I would say on the issue of trust that I want to know that I can trust every one of our students at St. FX University like I would trust in the first instance everyone who was on this call. Even the people that I don't know. In the first instance, and I'm a citizen of Antigonish, and I trust the people who live in Antigonish, and I trust every student when they get on our doorstep until I'm proven otherwise. And so that is the balance of understanding that we bring forward as we welcome students back in September.
Great point, Kevin. Thank you.
Andy?
Yes, Murray.
Can I just add on to that? I think the question also speaks to why would a student give information if they're risking expulsion and potentially risking students around them because they're at the same party, for example. So I think that's what the question was getting at. And from a contact tracing standpoint, it's public health that will be doing the contact tracing purely for purposes of finding out who may have been exposed to the virus, and not for sanctioned purposes for the university. And I think we need to make that clear.
Thanks for that clarification, Murray. That's very helpful. Thank you.
You keep mentioning landlords, but what are they agreeing to do? And how are we going to get similar cooperation from absentee landlords?
Thank you for that question. Elizabeth, I'm going to give back to you as you're a conduit into that group.
Mm-hmm. So far our discussions have been with some representative landlords who've then been working with the Landlords Association. So as mentioned, we will be providing a letter to introduce and provide them with copies of our Good Neighbors Guide, to be providing an outline of what they can do to support our students who are coming back to the community, and support the university and the town and the county with all of our collaborative efforts to provide for that safe and healthy living and learning environment. So that's the piece, and we are open to having town halls with all of our landlords, and with the technology available, our landlords who are from out of town will also be able to join those easily should the Landlords Association take us up on that offer.
Thank you.
Thank you. It has been stated over and over that testing and identifying cases is key. Will testing be done of students as they arrive in Antigonish?
Elizabeth?
So we did speak with Dr. Strang about the possibility of doing that, and his recommendation was that the absolute safest way of bringing our students back to Antigonish is to follow the 2-week isolation protocol, and to have students constantly self-monitoring their own symptoms. And when they are aware of their symptoms and they are self-monitoring their symptoms, and when they report quickly to 811, we will get them referred for the testing when they are symptomatic.
Thank you.
What responsibility does campus administration have to inform students or locals if there is a case of COVID-19 on campus?
Thank you for that question. It's a very good one. And it's a communication question, but it's something that's come up at a number of our meetings. And we do take on that responsibility to be transparent to our on-campus community and our off-campus community about how things are developing. Murray, can I ask you to take that on as well, please?
Absolutely. So Nova Scotia Health Authority obviously is the government agency that deals with communications for the province. They usually do it by zones. We are planning to be very transparent, having regular updates from Cenefex to the community, what's going on, and it will provide metrics. We're not going into this hiding anything or wanting to hide anything. We want to be absolutely transparent with regards to all the things that are happening with regards to possible infections or whatever that we're dealing with. But again, from a medical standpoint, we take our lead from Nova Scotia Health in terms of any information that we could release. But in terms of infractions or what we're doing from a behavioral standpoint. Obviously, without names, we will provide regular updates with regards to that side of the community standards, and also sharing the good news. We are absolutely certain there's going to be lots of positive information that we're going to share as well.
As we move into this, our intention is to maintain the dialogue, not just until the students return, but going forward. That is an important part of our plan. Open, transparent communication about what's going on, to build the confidence in what we're doing, and the reasons will be reinforced for why we did bring back those students. Without that, we recognize that we wouldn't have much of a good plan to go forward. We do need to communicate with you. As I said before, this is the beginning of that transparency that we are putting on the table, open to you to talk about what we intend to do.
Andy, I wonder if I might just add one further point, because a piece that, and I think it's inherent in what Murray was talking about, but our students and our reporting will follow the guidelines that are there from public health standpoint. We have to respect personal, private health information. We are not going to disclose information about individuals and what their health is. We will follow the guidelines that are in place under legislation and followed by every citizen of this province. Our students are no different.
Thank you, Andrew.
Thank you. We have a very engaged audience with a large number of questions left to be answered, and we are very close to our 90-minute time limit. So we're probably going to take a couple of more questions, and then please note that all of the questions will be collated and answered online within our website, probably within the next week. So if your question is not answered here today, have no fear, the answer will be available. So I'll go with one more. It was noted on the Q&A St. FX page that in Nova Scotia, parents will not be allowed to stop for gas, restrooms, or food. How can they possibly think this is okay? I assume New Brunswick will be the same. There is no way to traverse both provinces without stopping for these necessities.
Elizabeth.
Yes. We've been getting a lot of questions about this, and so this is the reason that we're in touch with public health right now to approve the self-isolation tip sheet. So we've recognized this, and we will be confirming the guidelines. We're recognizing this is a logistical issue that they're going to have to give us some more guidance on. So please stay tuned for that.
Thank you.
Great. Thank you. Where did we come up with the information that 1,000 plus students would come back to Antigonish if all courses were online?
Dr. Walmsley.
Yeah, that's an excellent question. And so what we've been doing is we've been monitoring the data that's being provided by other universities in the first instance. And so comprehensive surveys were completed at Bishop's University and Acadia University. And these particular questions were asked. And the vast majority of students, first of all, would prefer to be face-to-face. And the majority of students are paying rent and have already paid their rent. And so they are members of the community, and they planned to return. The anecdotal evidence tells us that students have been living with their parents for a long, long time. And particularly the upper year students are very interested in getting on with their lives where the opportunity is permitted. And so first from the survey data, and everyone in Antigonish recognizes very well that we are a word of mouth institution. And so we've been in close contact, Murray in particular, with our alumni members. And our alumni members who are parents are telling us that their students, sometimes multiple students in each household, are planning to return to Antigonish, whether we're face-to-face or online.
Thank you, Kevin.
Great. This is probably another question for Dr. Walmsley. What are our class sizes, and have they been reduced as a result of the changes to our formats?
Kevin.
This has been a real challenge for us. We have, of course, have a number of large classes and small classes, and St. FX, thankfully, is a small institution, And the quality of our education is in part due to the size of our classes, and they are small. But in every case, in every space that we have that is a classroom space, it has been significantly reduced. So for example, I'll give you the Schwartz Auditorium and the 300-seat auditorium in Mulrooney Hall. Those have been reduced from 300 seats down to 90 seats. And so we've lost significant capacity in all of our classrooms. And those, each seat has been measured out. And so all of that data was collected. And it took about 2 weeks to put a timetable together in order to fit the classes in the spaces that we had. It was a very difficult exercise, but we can provide the assurance that we've met the 2-meter rule regulation with respect to all of our class sizes.
I'm very mindful of the time on this one. I committed to keep the meeting on time and be respectful of the 90 minutes. As MJ has indicated, we have had a lot of questions and we have a commitment to you in order to collate those and give you answers in the next while. I want to remind you that this is the beginning of ongoing dialogue. It's the beginning of several sessions that we will have. Our second one will occur at 6:30 this evening, and again, we'll run for 90 minutes. I want to thank you for taking the time to be with us today. It really is important that we're hearing your concerns such that we can adapt that framework to accommodate as many concerns as possible and find the solutions. We are committed to that. We'll do everything we can in order to keep on improving those plans. Thank you for taking the time for being with us. Thank you, Mayor. Thank you, Warden, for joining the team. It's been a privilege to be with you. Thank you very much.
Thanks, everyone.
Bye, everybody. Thank you.
Thank you, everyone.
Bye-bye.
Bye-bye.